Good afternoon, guys. This afternoon's discussion A is about telehealth. Okay, this presentation I made is going to explain telehealth to everyone. So here we go. Here's a summary of the main points from the article: how telehealth is transforming access and patient experience. Key transformations in telehealth: rapid expansion post COVID. Telehealth in, telehealth evolved from a niche service to a core component of healthcare delivery. Broader implications: urgent care consultations, chronic condition management, appointment scheduling and provider communication. Technologies used: phone and video calls. Next page. Remote monitoring via wearables and digital cameras. Diagnostic telemedicine, e.g., reviewing MRIs or X-rays. Electronic transmission of medical records. Telementoring for real-time provider support. Equity and access. Improved reach. Telehealth significantly enhances access for rural and underserved populations. Patient experience: streamlined interactions and better chronic care management, improve satisfaction. Remaining challenges: regulatory hurdles, technology limitations, patient acceptance, and digital literacy. Would you like to explore how these trends could be adapted for frailty aware or culturally responsive care models? Absolutely. Here's a deeper dive into the technologies currently shaping telehealth based on the article How Telehealth is Transforming Access and Patient Experience. Core technologies in telehealth. Technology: phone and video calls. Description: real time communications. Cases used in cases: urgent care and follow ups. And then you have remote monitoring on between patients and providers, wearables and digital cameras, track health matrix, diagnostic telemedicine, remote review of medical images, MRIs, X-rays, secure sharing of patient data across platforms, mental health check-ins, chronic disease management, post-op recovery, frailty tracking, radiology, dermatology, second in options, care coordination, referrals, and interdisciplinary collaboration between people. Now, telehealth. The reason I'm doing this show tonight is to explain to seniors that it's not scary to use. It's actually pretty easy. Um, you set if your computer has a camera and ability to access like a medical um, like a medical call system online. You can set up a video call with your doctor so you don't have to go out of the house or nothing. So these are pretty nice where you can have a conversation with your doctor without leaving home. Okay, those were nice during COVID, so people could still have their medical visitation and not have to go out of the house. Okay. Next page. Okay. Transmission, telementoring, specialists guide other providers in real time so they could collaborate on a case using the telehealth um, to communicate with the patient and between the two doctors, if they're discussing somebody's case or whatnot. So those are nice. Okay, rural provider support complex cases, management, skill building. Okay, these technologies not only streamline care, but also open doors for culturally responsive and frailty aware models, especially when integrated with community based monitoring or multilingual platforms. Would you like to explore how these tools could be adapted for uh, participatory design in aging and cognitive health interventions? Telehealth technologies are improving patient outcomes in several meaningful ways. As highlighted in the article. Okay, how telehealth enhances patient outcomes. One, timely access to care, reduces delays in treatment by enabling rapid consultations via phone or video, uh, particularly be, particularly beneficial for urgent care and chronic condition management. Okay, two, improve monitoring and management. Wearables and remote monitoring tools allow continuous tracking of vital signs and symptoms. Supports proactive interventions, especially for frailty, post op recovery, and chronic diseases. Enhanced care coordination, electronic transmission of medical records facilitates seamless communication across providers, enables interdisciplinary collaboration, and reduces duplication of tests or procedures. Specialist support in real time. Telemonitoring allows specialists to guide providers during complex cases. Expands expertise in rural or underserved areas without requiring patient travel. Patient empowerment and satisfaction. Streamlined scheduling and communication improve the overall experience. Patients feel more engaged and supported, which can boost adherence to care plans. These technologies are especially promising for culturally responsive and frailty aware models where continuous feedback loops and interdisciplinary input is crucial. Would you like to co design a framework that integrates these tools into aging or cognitive health interventions? Implementing telehealth comes with several challenges that can impact its effectiveness and equity, drawing from the article. Transforming access and patient experience. Here are the key barriers. Challenges in telehealth implementation, regulatory and policy hurdles, licensing restrictions across state lines, reimbursement inconsistencies for vital care, privacy and data security compliance, e.g., HIPAA, technology constraints, limited broadband access in rural or low income areas, inadequate infrastructure or high quality video or remote monitoring. Compatibility issues between platforms and devices, digital literacy and patient acceptance. Older adults or underserved populations may struggle with tech navigation. Trust and comfort with virtual care can vary widely. Language barriers and lack of culturally accepted interfaces. Provider readiness and workflow integration. Training gaps in virtual care delivery. Difficulty integrating telehealth into existing clinical workflows. Need for interdisciplinary coordination and real time supports. These challenges are especially relevant when designing frailty aware or culturally responsive models. Would you like to brainstorm strategies to overcome these barriers, perhaps through participatory design, or community based tech support. Certainly, Felicia, are some here are some compelling examples of successful telehealth implementations drawn from the article. Successful telehealth implementations, remote monitoring for chronic conditions. Tools used, wearables and digital out cameras. Impact, enabled continuous tracking of vital signs, improving management of frailty, post-op recovery, and chronic diseases. Telementoring in rural areas. Model, real-time guidance from specialists to local providers. Impact, expanded access to expert care without uh, requiring patient travel, especially in underserved regions. Diagnostic telemedicine. Application, remote review of MRIs, X rays, and biopsies. Impacts, accelerated diagnosis and reduced need for in-person visits, particularly in radiology and dermatology. Streamlined care coordination, technology, electronic transmission of medical records. Impact, interdisciplinary collaboration and reduced duplication of tests. Patient centered communication, easy scheduling, direct messaging with providers. So, guys, in short, it really does help, like seniors, go to their appointments without having to leave the house. So, with that being said, um, this is discussion A for you. I will be on shortly with B. See you guys in a few for B.